thing is going to show you some options, visit options you have on the patient summary screen. If you right-click on your visit, you'll see you have some options here. You can jump to a visit. By default, your screen will show, your patient summary screen will show 3 visits at a time. If you want to look back at the visit from the initial exam or 6 months ago or last week or whatever, instead of trying to scroll 3 by 3 by 3, you can simply jump to any visit just with one click. It'll take you right there. If you right-click, you also have access to the quick soap. The quick soap is nice for follow-up visits. It's a much faster way to build your notes rather than going into the exam screen and going from button to button, screen to screen. You have access to your adjustments, your assessments, treatments, your plans, your diagnosis, your complaints, all on one screen. You can just simply go into the complaints and update the pain level, so forth. If there's anything different on any of the other screens, the palpation or assessment or treatment or plan, you can update those. You also can export your charges and your diagnostic codes over to the PM side. You can also clear a visit if your patient hadn't been in a long time and you want to start with a clean blank visit for any reason. You can clear the visit. It asks for your staff password, which is the word staff in lowercase. It'll keep the visit there, but it'll make it completely blank. You can start fresh. You can also lock a visit manually. By default, all visits will lock after 30 days. Once a visit is locked, it will require the staff password just to open up that chart, and that is, a log of that is kept in the audit log file, but you can manually lock them at any time. You can print your visit, your SOAP note right from here. You can copy and paste visits. In this case, since we created a blank visit here, I'm just going to right-click here and copy this visit. And then I'll right-click on this visit and paste it. This is helpful if you created a visit on the wrong chart. Maybe you opened Jane Cairo instead of John Cairo, or if you created the visit on a wrong case, you can copy visits from case to case as well. And then if it was on a wrong one, you would right-click and go on the wrong visit. You would go back and you would delete that visit, which also asks for the staff password. You can also paste visits to a new date if you want to insert a visit anywhere. This one here, 18th. Now we have 17th, 18th, and 19th. And you can change the date. If you created the visit on a day when you're just trying to catch up and your patient really isn't there that day, it's going to pull your system date. You do want to make sure it's accurate, so you can change the date to the actual date of the visit. And the rest of these last 4 items all have to do with the Meaningful Use Government Program, which is another training. And that's it for today.